Good morning. I'm Kieran Casey. This is the Irish Inquiry, and you're looking at Breathing for Life. The very wise man Plato is attributed or is accredited with having said that when you need wisdom, when you want wisdom and insight as much as you need to breathe, then you shall have it. So Plato knew a thing or two. This morning, I'm going to be joined by Patrick McKeown, a man with 20 years experience in breathing techniques. He's an exponent of the Buteyko method. He addresses sleeping disorders, breathing disorders, anxiety. He addresses asthma and has got many books to his name. He's worked with the mindfulness master, Danny Penman, brings years of experience. And I'm very much looking forward to what he has to say to us this morning. Patrick, are you there?
Yes, Kieran, how are you?
I'm very well, Patrick. It's lovely to meet you.
Good, likewise.
Now, if you wouldn't mind telling the people who are watching a bit of your story, how did you become involved in conscious breathing?
I suppose like everybody else, totally by accident. You don't choose this as a career path. You find it normally because of your own health issues. So I was a child, like many kids growing up in Ireland in the 1970s and 80s, and I had chronic asthma. And if you have chronic asthma, you don't just have problems with your breathing, but you tend to have a stuffy nose. And because of having a stuffy nose, I was constantly mouth breathing. And when we're chronically mouth breathing, we tend to breathe faster and upper chest breathing. So it's putting the body into a more fight and flight. But it's also, we're twice as likely to have sleep problems. So I was going to primary school, I was pretty bright. I was at the top of the class. Secondary school, I went from the top of the class right down to the bottom of the class. I was falling asleep in class. I never realized, or nobody ever said to me, that your breathing is impacting your sleep and your sleep quality is impacting your focus and concentration. So if you think of the pressures that we had, back and as kids do today, to achieve high results in their Leaving Cert, which demands a degree of concentration and good energy and focus. And yet sleep is not being looked at, and 25 to 50% of studied children persistently mouth breathe, and it goes even further than that. And there's a lot of documented evidence with the negative impact of mouth breathing in children has been talked about since 1909. So just by chance, in my early 20s, I did BESS in Trinity College in Dublin. And for me to get a degree, it took a lot of work. Because when your attention is fully stuck in your head and you're drowning in thoughts and you don't have energy, you're not able to focus on what you're reading upon. It's difficult to retain information and then to produce it. So the guy with poor concentration, takes a lot of work to get grades. And this is where it's really important, not just in addressing or using the breath as a means of helping to quieten the racing mind, but also to look at the positives of it. Like we were talking earlier on, and you said you've been using this for 50 years. And Kieran, I have to say, I agree. It has absolutely been one of the best things that I ever brought into my life. Far better than the education that I received at TCD. In terms of the use of it, in terms of creativity, intuition, productivity, calmness of the mind, and happiness. And it's known that if you have a wandering mind, and if you have an active mind and a racing mind, that it does affect happiness. And people whose minds wander the most are least happy. And this was studied. Matthew Gillingworth, a Harvard professor, they tracked 250,000 data points. I think it was trackyourhappiness.org was the app and the study. So there's something really integral about this. And I remember then reading, it was Sylvia Thompson. I was trying to remember her name, was the journalist in the Irish Times. And she wrote an article on the importance of breathing through your nose back in 1998 or thereabouts. I came across that article and it struck a chord with me because it spoke about breathing through the nose and it spoke about breathing light. And I was doing none of those things. I was a mouth breather. I was a fast breather. You'd hear me breathing at a dinner table. You know, the friends that I'd go to, their parents would be giving out that I wasn't able to close my mouth when I was eating because I had such a stuffy nose. You know, so that night, this is not an exaggeration, I did the nose unblocking exercise. You can unblock your nose by holding your breath. Known since 1923. And we've even had a pilot study on this with Limerick Regional Hospital in 2013, published as a letter in the Clinical Otolaryngology Journal. Reduction of 70% of nasal symptoms at 3 months follow-up. And I'll have to say, anybody listening, if you've got a stuffy nose, you don't just have a stuffy nose. It's going to impact your anxiety and it's going to impact your sleep. And if you don't have a good night's sleep, you're not going to have a calm mind. And I was there. So I used breathing from a number of different perspectives. One was the focus of the attention on the breath, but not just doing that alone. Because if the mind is in a state of emotional turmoil, it's very difficult to focus on your breathing. And most people will give it up and abandon it because they feel it's too challenging. We have to change respiratory physiology. And we need to look at breathing, not just from go into a studio and take this full big breath, because a lot of breathing is taught and there's no understanding on the background to it. It's not just that oxygen is good and carbon dioxide is bad. Discovered back in 1904 by a Danish physiologist called Christian Bohr, that it's the pressure of carbon dioxide in the blood that determines the release of oxygen from the red blood cells. I always had cold hands and cold feet and I had brain fog. And I never attributed it to my poor breathing patterns. But when I sat down that day after reading Sylvia Thompson's article, and I went into the Berkeley Library in TCD, and I went onto their internet at the time, which was very basic, and I started looking at techniques of how to practice this. And I started slowing down my breathing and reducing the volume of air that I was breathing in. And it was the first time that I improved the temperature in my fingers. I never realized that the 70,000 miles of blood vessels in the human body are impacted by how hard you breathe. And if you start, you know, if I was to say to somebody, or somebody says to me, well, Patrick, somebody said to me this years ago, he says, Patrick, they couldn't have all got it wrong. And I said, I think they have. I genuinely think they have. And it's not just that they got it wrong. It's got the message has got distorted over the years. A yoga therapist arrived here about 3 years ago. Her name is Rottenberg, and she's a 30 years instructor training in yoga, having been trained in India. Developed chronic asthma. She developed, I think, sleep apnea as well, which often goes hand in hand. People with asthma tend to be tired. That's not always told, you know. You don't hear that coming from the Asthma Society of Ireland, unfortunately. But people with asthma do tend to be tired and do tend to be stressed. And we've got one of the highest incidences of asthma in the world in this country. And nobody talks about the importance of nose breathing. But coming back to Robin Rottenberg, she came to Galway here. She was here for 2 weeks. She was doing instructor training. We were talking about the benefit of breathing light. What happens when you actually breathe less air than what you're used to? Because with modern living, our breathing patterns have changed, and many of us have a habit of breathing too much air. And I know that sounds kind of a little bit strange, because you would think that the more air you breathe, the more oxygen gets delivered to the brain. That's not correct. If I said to somebody, I want you to take 10 big breaths in and out of your mouth, they're likely to feel lightheaded. Lightheaded is a sign that blood flow and oxygen delivery to the brain has reduced. And I was that kid and teenager, as many people are, breathing faster and breathing up our chest and breathing too much air. And as a result, we have a state of physiology that there's no way we will have calmness of the mind, because the central nervous system is in a state of arousal. And you can do all the meditation in the world, but as long as the brain is in a state of brain cell excitability, there's something that's not being addressed here. So, you know, I'll just give you another example. That night then I taped my mouth shut, and I did use breathe right strips over my nose, but just in case my nose got stuffed up. I woke up the next morning. Yeah, I was kind of getting used to it. I can't remember anything that big the next morning. But I did it again the second night. I taped my mouth closed the second night, and I had breathe right strips on my nose. And I woke up the second morning, and it was the best night's sleep that I had in about 15 years. And this is all in the literature. 400 years ago, it was talked about the importance of nose breathing during sleep. And yet 50% of adults breathe through an open mouth during sleep, and they wake up with a dry mouth in the morning. I said yesterday, I wrote an article co-authored with an ear, nose and throat doctor, Dr. Carlos O'Connor and Dr. Plaza. We had it published in the Journal of Clinical Medicine last week. And this is a high impact journal that's peer reviewed, that's published on PubMed. And it's the first time that there's an application and a recognition of the impact of breathing exercises during the day that can impact your sleep. Now, before I go off on another tangent, I'll come back to Robin Rottenberg. So Robin Rottenberg practiced what we were doing, and we're looking at functional breathing from 3 different dimensions. The biochemistry is about taking less air into your body to improve blood flow and oxygen delivery. More oxygen gets delivered when you breathe less air. Now, that may sound as being the most bizarrest thing in the world, but that's based on what's called the Bohr effect, B-O-H-R, and it's normal medical physiology that's found in any respiratory textbook. But yet, all too often we hear the more air you breathe, the more oxygen that's in the blood and the more oxygen that's delivered throughout the body. It's nonsense. If you breathe a lot of air, you can do breathing exercises which can be beneficial, but the purpose of them is not to increase oxygenation. The purpose is to stress the body, to force the body to make adaptations, and I'll refer to the Wim Hof method, which is a good method. But I think we have to understand physiology here.
What we're talking about, then is the breathing paradox. If we could backtrack a little bit there, in terms of just a particular individual, are there any psychological or physiological triggers? Say if we take a newborn baby, are newborn babies generally breathing correctly? They're breathing through their nose and breathing at a particular rate. So what triggers can happen that will actually cause this natural kind of and the innate form of breathing? What will it cause that to change?
There's a lot, Kieran. You know, the heart rate variability of the baby is impacted by the HRV of the mother. And heart rate variability is a clinical measure of vagal tone or stress. You know, normally if you go to your doctor and if you say to your doctor, I feel stressed, the doctor typically has no way of measuring the impact that stress has on your body. But heart rate variability will tell you. And anybody who's undergone or prone to anxiety or depression or PTSD have typically lower heart rate variability. So you'll have a baby born and their HRV is reflective of that of the mother's. Now, the baby is born breathing in and out through the nose because anatomically they cannot mouth breathe until, for example, the top jaw drops down. The epiglottis drops down so that the soft palate and the epiglottis aren't meeting. So there's space for the baby to breathe. But here's another thing, you know, you can have babies born with a very high narrow palate. And it's genetics. My own daughter was born that way as well, and probably partly my genetics. Not good. And these kids are at risk of sudden infant death syndrome because they already have a high narrow palate. And as a result, the roof of the mouth is the floor of the nose. And if the palate is too high, the child can't breathe properly through the nose. And if the child then gets a stuffy nose, if that child cannot switch anatomically to mouth breathing, that child is really in trouble. And these children can unfortunately die with sudden infant death syndrome as a result of something that could be avoided. And, you know, these are not my words. The top sleep doctor in the world, Dr. Christian Guilleminault, he spoke about the critical importance of restoring nasal breathing in pediatrics back in 2015. He coined the phrase obstructive sleep apnea. He developed the apnea hypopnea index, which is a measurement of the severity of sleep apnea. And he spoke, I remember, you know, I spoke alongside him several conferences, and I remember him standing up in a group of 600 or 700 doctors and saying, doctors, you're talking about everything except the elephant in the room. And the elephant in the room is restoring nasal breathing during sleep. And this is so simple, Kieran. And the problem is that it's not going to promise profit. That's really, you know, people might say, well, where's all the evidence? The evidence is there over the years and it has been well documented. One paper in larger scope published in May of 2020, looking at 95 individuals, adults with obstructive sleep apnea. The individuals who for mouth breathing had almost double the severity in terms of the AHI index. So there's other factors as well, Kieran. Tongue
Just
tie.
again to ask another question in terms then of your own work. I mean, one, when it comes to parents looking at their children, what should they be mindful of when they're actually considering the way that their own children are breathing, to give them some indication that their child would need some kind of therapy to address this, or some form of exercise to address it?
Yeah, you should never hear a child breathing during sleep. Shouldn't snore. And if you want to find a little bit about the literature on this, go to a study by Karen Bonuck, Bonuck, and she looked at 11,000 children in Stratford-upon-Avon in the UK, and it was published in Pediatrics in 2012. Children with sleep disorder breathing, which is impacted by mouth breathing, and that includes just snoring. The children don't have to be stopping breathing during sleep, even if they're just snoring. These children, if they had sleep disorder breathing at age 5 and untreated, they had a 40% increased risk of special education needs by age 8. We have no idea of the impact of sleep disorder breathing on cognitive development in children. And I'll answer your question in a second. But back 100 years ago, it was documented in a dental journal called the Dental Cosmos that children who mouth breathe, they develop craniofacial changes, their jaws are set back, their teeth are crooked, they have longer faces, they have compromised airways, they're not able to concentrate in school, they're greater risk of ADHD. And the dental industry has debated this for 100 years. Can you imagine an industry that's armed with the most intelligent people, armed with medical and dental degrees, and they're not able to see the simplicity of the importance of restoring nasal breathing in children? There's been studies done in the 1970s on monkeys, blocking their noses by Harvold, Harvold. He surgically blocked the noses with monkeys, causing them to mouth breathe, and all of the mouth breathing monkeys, they developed changes to their shape and jaw and compromised airways. Nobody should have crooked teeth. Crooked teeth is a sign that the jaws are too small, and when the jaws are too small, there's not enough room for the tongue. So coming back, and if there's not enough room for the tongue is likely to encroach the airway. There's a few things here. Processed foods have not been good in the development of the jaws. Our ancestors typically ate hard foods, whether it was vegetables, whether it was a bit of tough steak, and children were forced to chew and develop the muscles of the face so that they don't have poor muscle tone and they're not there with their mouths hanging open. Lack of breastfeeding, and of course I'm not going to blame any mothers here, because we have a society that, in my generation, when I got onto the housing market back in the boom, both of us had to work, because there's no way we could have a house over our head unless we were working 40 and 50 hours a week. That was inevitable. So mothers have a hard time with this, but breastfeeding is not just about nutrition for the baby, but it's also about manipulation of the muscles of the face necessary for craniofacial development. So if you think it takes effort for the baby to take the milk from the breast, and this is good because it's helping to develop muscle tone and function. Now, tongue tie is another aspect that doesn't get addressed in this country, and that's when the frenum that's holding the tongue to the floor. So if there's a piece of string that holds the tongue to the floor of the mouth, and if it's too tight, the baby can't get the tongue from the floor of the mouth up to the roof of the palate. And two things are implicated here. Number one is the baby can't breastfeed. So the baby is chomping on the mother. The baby isn't thriving because can't get enough milk. The mother, of course, is feeling pain. And as a result then, what's done? No attention on whether the child is tongue-tied or not, but introduce a bottle. And as soon, of course, as the bottle is introduced, the baby isn't going to go back to the breast because it's so easy to get milk from a bottle. A bottle and the teat in a bottle doesn't help the growth of the child's face. Pacifier use, the dummy that kids use, every 1 year of use of that increases the risk of mouth breathing by 25%. So, yeah, there's so many factors involved here, but I think parents have to just look at, do you hear your child breathing during sleep? That's really an important one. If your child is distracted, do you notice that they're just sitting there with their mouth wide open? Are they breathing through the mouth? for example, is the child, typically children will tend to breathe using the diaphragm, but if the child continues mouth breathing for a period of time, they'll often drive their breathing to the upper chest, and upper chest breathing, you know, can affect the emotions, because fast upper chest breathing is going to cause anxiety of the mind. Now, there's different breathing exercises. It's so easy to work with children. Any children with asthma, you know, I've seen amazing results with kids with asthma. We've had several papers published in this. I was involved with 2 papers myself, published in the American Journal of Respiratory and Critical Care Medicine. And Kieran, nobody knows about this in Ireland. Very few people. And
another question, sorry, if you don't mind. In terms of working with children, what is the youngest age that you can actually interact with the child and get the child to respond to suggestion and instruction?
3 or 4 years of age. Like this, I wasn't prepared. So this is my book, but it's not obviously in English. I don't know what language it's in, to be honest with you. It could be Dutch.
Always breathe correctly.
This is Always Breathe Correctly for kids. And we teach young kids, you know, through little stories of different exercises of what they can do, and everything is in books. So Always Breathe Correctly is the children's version, and all the kids exercises.
Is that available over here?
Yeah, it's cheap as well. I don't know, €7 or €10 or something. You know, it's available online through our websites. And all of the children's exercises are available as well. They're free. Like if you just put my name into YouTube and just put in Patrick McKeown children's breathing exercise, you'll see all of the kids' exercises for free, because I wanted to try and get the information out there. And if people are wondering, well, where's the research? I've put up a page on our website, buteykoclinic.com, and I've put a good bit of research there. But I've just written a new book called The Breathing Cure, and it's 500 plus pages. This is a big book. This will be double the volume of a normal book that you'll probably get in a bookstore. And I'd say 1/3 of it is devoted to kids. All of the exercises, but the research as well. Now, just before I forget, I'm going to come back full circle, Kieran, to Robin Rottenberg. Mm-hmm. So Robin Rottenberg was practicing breathing less, the opposite to what she was teaching in yoga for 30 years. She was intrigued. So she went back to the ancient yoga sutras, and she asked, when yoga was developed, how was breathing instructed? And the one word that she kept on coming across was the name subtle, that breathing should be subtle, that breathing should not be hard. And this was really interesting. So she went and wrote a book called Restoring Prana, from a yoga perspective, looking at the benefits of the biochemical aspect of breathing. And I think really we have to learn something here. Yoga is a wonderful modality, but how is breathing being taught? And it's not just about taking, you should never hear the breathing of anybody in a yoga class. You should never hear it. Or if you do hear the breathing of people in a yoga class, make sure that you also give them breathing exercises to breathe light to restore biochemistry. We have to get this idea out there that, like, I'll give you an example from a practical basis. I was anxious going into an exam, again, back in university. And just before I went into the exam hall, I took a walk for 2 to 3 minutes. And during that 2 to 3 minutes, I took these full big breaths because I believed this was beneficial for me. And I went into the exam hall and I was totally spaced out and lightheaded. Now, I should have done the opposite. I wanted to get blood flow and oxygen delivery to my head, not to be in a state of lightheadedness. And this whole idea is really something, you know, it's starting to change. James Nestor's book, he became a New York Times bestseller last year. He's actually done more in terms of breathing than anybody else in the last 20 years. He's done anything. He's incredible what he's been able to do. He wrote a book called Breath, and it's all about the importance of nose breathing and carbon dioxide. And a lot of it is stuff that we've been talking about for 20 years and stuff that's in our books for 20 years. But as a journalist, he was able to investigate it, and he was able to write a lovely story as well, which is very, good, and it's put out there. So, I think people...
If I could interrupt, I've actually bought the book last week, and I've looked into it. And one of the things that I've noticed in it that he talks about taping his own mouth at one stage to deal with his own. But now just to relate this back to the fact you said that these breathing exercises can help people who snore and suffer with sleep apnea.
Yes.
So how can an exercise that's done while a person is awake and conscious affect how they breathe while they're asleep and in that unconscious state? How does the crossover happen?
It's the same physiology. You know, if you're breathing fast and hard during wakefulness, you're going to breathe hard and fast during sleep. And to give you an example, there's two types of snoring. One snoring is through the mouth, and it goes like this. And the other snoring is through the nose, and it goes like this. Now, what I'd like you to do is, I'd like you to close your mouth and to try and snore with your mouth closed. Try and snore through your mouth with your mouth closed. So instead of, can I snore if I have my mouth closed? Can I snore through the mouth? So can you snore through your mouth though with your mouth closed? And the answer is no. So number one is mouth snoring stops when we get the mouth closed. Now the second aspect is nasal snoring. So nasal snoring is like this. Now, if we breathe really light and you take a really soft, gentle breath in through your nose and a relaxed and a slow and gentle breath out, and a soft, gentle breath in, and a relaxed and slow, gentle breath out. Now, when you're breathing lightly, really soft, try and snore through your nose with light breathing. So try and snore through your nose with light breathing. And you will find it's more difficult to do. It's not just about the airway. Like, no engineer would look at a tube without considering flow. But in terms of the anatomy of the human airway in sleep, the only thing that the doctor seems to be looking at is the airway. They're looking at the pipe, but they're not considering the flow that's going through it. And if we look at people with dysfunctional breathing patterns, 75% of the anxiety population. But asthma, we have 500,000 people with asthma in this country. And when asthma gets worse, so does sleep disorder breathing. And typically, as an asthmatic, if asthma gets worse, we breathe harder, we breathe faster, we're breathing more up our chest, and that's increasing turbulence in the upper airways, and that's then contributing to snoring and even more collapse of the airway. And collapse of the airway is called obstructive sleep apnea. It's when the individual is breathing hard and then they stop breathing altogether. The guy is typically a man, more so than a female, but when females post-menopausal, it increases by 300%. But the stats on this are huge. You know, it's 26% of men aged between 30 and 50 years of age. 26%. And when I hear of a 40-year-old man dying in his sleep or dying as a result of a cardiovascular event, I really have to wonder, did this person have obstructive sleep apnea? And like one of my friends, my brother's friends from Dublin, he died at 42 years of age about 2 months ago. And in conversation, when I was talking to my brother, and I said, has anybody ever said that he was snoring heavily? And they said yes. They were always complaining that his snoring was really bad. We cannot be stopping breathing during sleep. It's such a stress in the heart. It's linked with stroke, it's linked with heart attack, it's linked with diabetes, it's linked with cancer, it's linked with dementia. But more, it gets worse as we get older. So from the age of 50 to 70 years of age, it affects 43% of men. And for females, post-menopause, it's 27%. Now, in children, it's between 1 and 5%. And a child who has obstructive sleep apnea, who's snoring badly, you know, academically, they have 10 times the risk of learning difficulties. And all of this, there's studies to show it. Like, this is not just my words pulled out of the blue. But unfortunately, the awareness of it is very poor. And doctors don't typically get trained in sleep. They're not aware of sleep apnea. You know, so until there's a major shift here, and the shift has to be this: breathing, sleep, and the emotions go together. If your mind is racing, you cannot fall asleep so easy. You lie there awake, running all this stuff through your head. And then you wake up at a poor quality, after a poor night's sleep, you wake up feeling tired and your mind is racing.
Well,
So
Patrick,
yes.
we are arriving at a time now when you are going to have to show all of the viewers exactly what you're talking about. This is now time for the practical demonstration. So folks, I'm going to bid you farewell now for the next half an hour, and I'm going to leave you in the tender, loving care of Patrick McKeown. Thank you very much, Patrick. Talk to you later.
Thanks, Kieran. So the first thing that we're going to look at is measuring your breath hold time. And this is something that will give you some indication of how well you breathe functionally. This is more appropriate for adults than for kids. And to measure your breath hold time, you're sitting down for say 5 or 10 minutes.